Not all of the 24 approved private clinics have received their Sinovac supplies just yet, and so many turned away walk-in parties and placed them on registration wait lists instead. The clinics which our ST colleagues visited this morning said that the waiting time for those who register successfully could be 2 weeks or more. Well, Dr. Leong, it's back to you. The Rofi Clinic has received its supplies and started administering the shots from 4 p.m. today to an initial batch of about 20 people. What was the sense that you got from them now that they have this Sinovac option?
I thought that the Sinovac vaccines were more popular than the Hello Kitty dolls that are being sold at McDonald's, because we have been receiving hundreds and thousands of calls and messages to try to get themselves registered. I'm very, very happy and thankful that the public places so much trust on us. But at the same time, you must understand that as a clinic, we are not really suited to cater to the BTS-like equivalent demand for the McDonald's packs. So coming back, I want everyone to just be very cautious, be understanding. I mean, it takes time to get all these thousands of vaccines going through. Number two, register yourselves, myself, my clinic, or other clinics, or any other clinics which you find happy with. We will get to that number. If we commit ourselves as a clinic to give the vaccination, we will do it there for you. Number three, many of us started with low numbers now, just to have a feel of the whole operations and how it's going to go through. We will have many hiccups, and certainly our quality of care, our quality of love given to our patients may be a little bit lesser, but nonetheless, it is still very earnest. So if we did anything wrong, I apologize to you on behalf of all the clinics there are. Bear with us as we try to get many people vaccinated. I do understand that the COVID-19 vaccine comes on the mRNA as well as the Sinovac, and many people have a lot of hesitancy with the mRNA. Scientifically, the mRNA vaccines are still better, but if you have no other choice and you insist on Sinovac, getting Sinovac vaccination is better than nothing.
Right. Well, like you said, you have received thousands of sign-ups to the wait list. How does the Rofi Clinic plan to handle this overwhelming response, Doc?
We have to pull in extra people to help. We're trying to work out protocols. We're trying to use AI to help us in terms of registration online, so as it becomes more seamless instead of having to write and then transfer, so as to try to, digitize our registration. So all this is trying to smoothen the whole processes and make things easier. Now, it is challenging because none of my nurses are ready for these numbers, but we will get there. We will deliver the shots to Singaporeans.
Could you share more on the process of obtaining the Sinovac vaccines? How does your clinic work with the Health Ministry on that?
First of all, the Ministry of Health actually opened up the applications to many clinics, asking them what would the pricing of the vaccine will be, what facilities, and I understand that is more important. What facilities, what contingencies you have to place the vaccines, to hold the vaccines, to administer the vaccines. In fact, they look at your experience in giving vaccines before they just issue it to any other clinics. So our clinic and many other clinics have given many influenza vaccines, pneumonia vaccines, even shingles vaccines, etc. With all these, it gives us a lot more, them a lot of confidence that we can deliver the same vaccines correctly and timely. And of course, the storage. For my clinic, for example, we actually have thermometers that will actually inform us remotely if the fridge goes down. So if the temperature goes beyond a certain excursion, it informs us. So number one, they look into that. And then after that, they will inform us that we've been approved, and then we have to sign a contract with them. And the Ministry of Health is quite strict on whom we can give the vaccines to. And this will be helpful for listeners. It only gives to Singaporeans and foreigners who have the right of abode. That means you have the chance, you have the permission to live in Singapore, then you can actually get vaccinations. Number two, if you have received the Pfizer or Moderna vaccine in the past, at this point in time, you are not eligible for the Sinovac vaccine. The purpose is very straightforward. We want to get as many people vaccinated first before we talk about double vaccination for others. So that's basically are the rules. And when we applied, we were informed of it on Wednesday. By Wednesday evening, the news went out. By 2350 Wednesday night, the calls started coming in, booking for vaccinations. And of course, the vaccines arrived today and we have started giving to our first patients.
Well, Dr. Leong, it's always a pleasure to have you on the show. Thanks so much for sharing more on your Sinovac vaccine rollout, as well as your insights on our COVID-19 situation. I've been speaking with Dr. Leong Ho Nam, an infectious diseases specialist from the Rofi Clinic at Mount Elizabeth Novena.